I think everything should go then. Hopefully. And then let me check here. Oh, is it not working? Or it is working? Oh yeah, it is working. Tap, tap. Finger tap, tap. Yeah, okay. Everything's good there. Let's do that. I shouldn't need this anymore. And then this one. So I'll keep this up for just now. Same with this one. And then, yeah, I think that should work. Cool. Alright, well, we'll see. How can I tighten my dentures? Okay, so if you can hear me, Triple G. How can you tighten your dentures? Your dentures are made out of an acrylic material that is going to be difficult to add to for long-term success. So what I mean by that is you can use soft reline materials that you can get on Amazon or probably from the grocery store or whichever, but those are only meant to last for a short amount of time. And you can read that on the box. It'll say like, oh, it lasts for 1 week or 2 weeks or a month or whichever it might be. So for long-term tightening of your dentures where it fits better, if you have proper bone and anatomy and everything, is getting a hard reline. That means going to your dentist, they take an impression with your dentures, that gets sent to the laboratory, they do a reline, and however long it takes for you to get it back, it should be a tighter fit from there. So hopefully that's a route that you're able to take. But if you just kind of want to get let me see how tight they can feel by doing it myself, then go in and learn finding a soft reline material for dentures is a good way to start. Alright, so no, I don't want that. So hopefully that made sense, and hopefully you're able to hear me. Alright, let's go and do some teeth settings. And for that, we'll do this. And just some setup wax. Alright, so let's add this. Pray, pray. Hey, CC. What's up, Bev? Go bring. Let me go get it for me, and then I'll try to fix it. So now that I have my wax fairly melted and ready for me, we go place some, elute it to the base plate. And let let me go and see that one. And I can fix it. And 2x2. There you go. Good job, baby. Monument. Oh, I wish. So we'll do that one, and that starts everything else. In Northern Massachusetts, on the state please. Back to California. Wish I just sized about it. Let me take these impression caps off because I know they're going to ruin my setup. So I'll keep these off to the side for now. This goes into this pan. Right. Such patience and detail. Yeah, you could say that, but other technicians, other laboratory technicians will say you're just slow, which is fine. It's not a bad thing to be patient and everything, but definitely when all your other like coworkers, I don't have any coworkers right now, but other people in the industry are like, "Oh man, you're really slow." It's like, yeah, I'll just take it like that. I think the main thing that comes out of it is because I'm allowed to take my time because my boss isn't breathing down my neck, and that's a lot of difference that other technicians or laboratories don't exactly have, and I say that because it's only me. It's only me and my wife, and unless she's telling me to, hey, do that denture faster, I don't have anyone kind of pressuring me unless it's like a doctor that just wants something back before a certain time frame. And then at that point, it's like, okay, well, I can bust out faster amount and such, but I was a little bit luckier than others. So stuff like this, I know that canine is going to be a little bit too up. And the main thing is because of this implant that's right here. So that means I'm going to have to dig at this one. Oh, thank you. Alright, so now we got a better seating. It looks like it's just about there. Melt the wax a little bit, set it back just a little bit more, and I think it's going to be exactly how I want it to be. Pointing right down our ridge, and it's hiding everything well. I could pull it up a little bit, but we'll leave it as it is, and then we'll play with that idea later on. So this is sitting right above that, so that's going to be a tough one. I might have to take more out of that canine so that this can sit right onto that implant. Let's make all the front teeth be set. And a little bit more wax. Very interesting. Yeah, different, right? Not many, not often you get to kind of see behind the scenes, or if you are someone that's behind the scenes, then it's always like another lab technician. Then it's kind of cool to see another person's just the way they approach things. Now we see if this a little bit more melted right in that dead center. Back as I want it to be. Alright. I just had my implants uncovered last week. Lowers only, traditional upper dentures. Okay, that's a good arrangement, or I would say that's a good place to put your money towards, is that arrangement, because if you don't have a gag reflex, awesome. You're able to handle a upper denture all normal and such, so that's cool. Let me see. How do I do this? 1 second. Let's see. Hi, Baba.
Can you hear kids crying?
No. Alright. Mars. Oh, listen, is that the hands for the music, I'm guessing? No. Now it should be, now this is going to be the tougher one, which is going to be setting it right above this canine spot, but it looks like I have space. Looks like I might not need to trim any of the ridge lap for this one. Maybe. We'll see. Oh, Papa Roach? Yeah. I snuck in Backgate during a festival, so I'm 2000. That is cool. That is super cool. Yeah, they've been a solid band for a long time. Is this Wax? Yes, this is Wax. This is gonna become a Wax Triant, and so everything is in wax. So this is setup wax, or just a stiffer wax that resists melting and shifting and distortion. Especially here in California, where we get 100-degree weather also during the summers. I don't want anything shifting or moving, especially when we're transporting it over to the dentist office and such. I was selling pizza and Domino's outside the gate. That is super cool. What is this one? This Mayday? Yeah, this is Mayday. Yeah, I should have room to set that. That is cool. I love this. I love to see this process. Wish I can get mine redone. I mean, yeah, I would say right redone. It's expensive to have to get them done, or maybe you're within like your insurance allowance, your insurance's waiting period time, so you have to wait for it to be approved again or something. But it's nice, especially once you've been through it once, to be able to say, "Oh, thank you. Oh, hey there." Thank you for that little sticker doodad thing, whatever they're called. Let me set up my molar here. I was gonna say on that one, it should have been delivered already, or it should deliver. Okay, let's get to the. Yep, there you go. I was gonna say, yeah, it should be there. I've been checking it myself also. What does this person's previous one have? It has all the teeth on there. We'll see about doing that with all the teeth. I'm not sure if I'm gonna arrange it that way. But no, that's gonna be super cool. I hope it works out. I hope that it makes a difference. This upper has a little bit of oh yeah, no problem. Hopefully if it works out, like I mentioned, I made I also made like a duplicate of the Wax Tri, but in acrylic, so there's something to wear in the waiting time. In the meantime, let's see. This upper arrangement is kind of funky. Which I can't do anything about the upper. I'm mainly fiddling around with the lower. Oh, you're so nice. That is cool. I'm trying to use up all the wax I can, meaning that I have to take this little itty bitty piece of wax to my flame and usually burn my fingertips a little bit, but I'm pretty good at not feeling that if I need to. Alright. So that should be good. I'll add this to the top of my next wax set. Where's my tool? Let's see, what song do I want? Really important. to do Good Charlotte. I need to get some more Good Charlotte songs on my playlist. Let me see what your question is. I've been told what I'm told is a floating denture. So I'm guessing that's the lower, where the front gums are really shallow, and I want to hold the denture. Hold the denture so the bottoms is always moving. Okay, so yeah, so a floating denture, it sounds like what it is a boat without an anchor, which is the lower denture a lot of times. And making it like stay in place is really difficult when there's either, like you mentioned, shallow ridge or not enough bony protuberance where your denture can't just grab and kind of be less influence to dislodge. It's nice to have that, but a lot of times people have really shallow ridge and not a lot of area to grab onto and things float. In those cases, a lot of times we try to, if you go to probably what's called a prosthodontist, a dentist that's specifically specialized in making crowns or dentures and everything, you may get a better result, but it all really depends on your anatomy. And if your anatomy is really shallow, like you're mentioning, it's tough. The best case scenario, lower implants, do like two or four implants on the lower. It's a big cost to do, but that's a great way to anchor your piece to your body so that it doesn't shift or move. Apart from that, that's kind of just what lowers offers, unless you have a really good bony ridge for your denture to grab onto. I don't know much when I don't know. Okay, so I should have room for this premolar here. Is he stuck with using adhesive, just like floating dentures? Stuck with using adhesive, just like floating dentures. Yeah, that's a really important thing. And then so another one. Hello, follow you since 2018. Oh, that's been a long time then. That was when I started teaching then, and I probably uploaded my first video at that point. What's your specialty? Always wanted to ask, what's your specialty in dentistry? Are you an associate doctor or just a technician? I was an assistant prior to this. I was a dental assistant, and from there I became a laboratory technician. So 14 years in 14 years 14 years doing that, and then about 2.5 years now doing the dental lab technician thing. And from there, who knows where I'll go, but hopefully I get to stay in the dental lab field, and then I can go and with enough experience and enough know-how, go to teach dental lab, or even like be a product specialist for like a company while I still do my lab duties and everything. So hopefully there's a lot to do, but it'll just take a little bit of time. I use something called Dynatech. I think it's called, and it helps a lot, but not for long. Oh, as you mentioned on that one tap is that's probably an adhesive or some type of sticky product to make your denture kind of stay in place. Yeah, I mean, and that's the thing. A lot of times things will work differently for everyone, and one product might not be the one for you, and that's where just keep on trying a few of them. Try to get as much sample size products as you can, so you don't have to spend top money for bigger product or for the whole product and it not work, function, or taste. That's a huge thing. Is some people will be like, oh yeah, this product works great, but it just tastes the worst. Thank you. Oh yeah, no problem. No problem. No problem, buddy. I see you over there on YouTube. And that goes in there really nice and solid. That's good right there. Alright, let's go to the other side. Let's drop my molar in place. And there's really no need to put a second molar back here. So we'll kind of see where we're at with that, especially since the upper opposing is I'm guessing it's a fixed all on X zirconia hybrid or zirconia denture or something, but definitely it's got a different look to it, and it looks like a fixed prosthesis. Alright, so let's go and get a little bit more wax, set this up. We have, if everything goes right, we'll have 3 more teeth to finish, and then we'll do some niceties, festoon it, and then we go from there to getting it sent back to the office, more likely tomorrow. That's a lot of room right here that I'm going to have to close up with just premolars. So we'll see how that goes. I have a feeling we're going to have to shift the molar forward. Because this is... What was that, 27? Oh yeah, this side was made either longer or something. The canine's a little bit shorter on this side. But just from here to here is not 27. This is 24. Yeah. Especially this was milled or something. Or no, zirconia. So this was specifically made to fit a weird opposing. And so these are going to be odd. Thank you for if I'm a specialist, the try one. Thank you for. Oh yeah, definitely. I have to see if I can remember the name. Yeah, let's try and throw these in there. I might have to throw the molar on this side, which means just for looks, I'll throw the other molar on the other side, and things will at least look like they should be going to the right place, or equal, the same, symmetrical. Oh yeah, it's definitely not gonna go over that reach. Wow, this is funky. Okay, so... Alright, so it's not gonna be an issue to place these last 2 ones, so I'm gonna go backwards and set my first premolar, or first bicuspid. So soften that, get this in place. that's what's happening. The base plate underneath is going to prevent me from setting this where I want it to go. So, either to have the option of removing some base plate or shortening the length of this tooth. And I'd rather shorten the length of the tooth a little bit. You're so funny. Ali is watching me. I don't want to put that. I don't want to put this last molar in there. There's really there's not really a nice amount of room on this for me to drop another molar in there. But the previous denture had them. But if I put more pieces past or towards the terminal end of this, it's going to try to dislodge because there's nothing over here. We'll have to see. We'll send it in as it is, and then we'll go from there to see what the office wants to change. So, with that, then, it is prosthodontist or periodontist? Sorry to keep bothering you. No, it's good. A prosthodontist is the one, just like prosthetics, fake, artificial, that's prosthodontist. Specialized maker of fake things with teeth. Perio will be for gums. If you're going to do like any type of thing like implants and stuff, gums would be, you'll want to go to a gum doctor, gum specialist, or an oral surgeon, or even a general dentist can do it, but usually it's between the oral surgeon and the periodontist. But prostho, if you're just going to get denture made or want like a really good thing made, that's where you go to. Okay, so let me go and get this off. Let's see if we can without messing up everything. Right about there, and right about here, and good. No problem. I'll have to go and steam this to get all the little bits out, but we'll see. But I do have this now. I can go and hit some of these spots up with some good melted wax. Alright, so now we're going to make it look pretty. Or we're going to try. So let me go and hit it up with some cold water. Get some different wax. We'll throw these in that case pan to save for later. Alright, so now to add wax, we'll do it in a strip wax form, which means we have to get this really hot. And once we get this really hot, we can move forward with doing it. Almost there. Just get some of this wax prepped so that it can be merged to the new wax. Need a little bit of wax right over here. A little bit over here on the back. Now we go and melt it so that it all merges together into one. Now that we have that in its place, I'll add some piped in wax on the lingual. And then we'll look into cleaning everything up. Let's see. Say goodbye this time. You say my story. Alright. Chill it in cold water so it stays. Where's my goggles for this? They're there. We'll see my story. Crawling back to you. That was where I come to find be happy when I thought I knew. Do I wanna know if this feeling goes both ways? Let's see. I guess I don't have a wax one yet. I'll just use this one in the meantime. A little bit of a check. And his last breath spoke, he had seen all to be seen. A life that once broke, now an empty grave. A little bit of shine left to do, but for the most part, that should be what we need. Not boundless, this needs to be kicked back just a little bit. So we don't need the light anymore. compared to this. Yeah, the freaking yeah, they kept the second molars out of occlusion on the old one anyways. So they're really not providing much. We'll see if they like this. So these go back up here. Alright. And then we'll call it right there.